I'm Dr. Jeffrey Weisz. I live in Calabasas. I'm a physician. I'm the former executive medical director of Kaiser Permanente in Southern California, meaning I was responsible for all the care delivered to Kaiser Permanente patients. We had close to 3.5 to 4 million members and 5,000 doctors. I practiced hematology oncology for over 25 years. And the last 15 years or so of my career, I was in the administrative side of medicine. I get a chance today to talk to you about COVID and staying healthy. I have a unique story to tell, I believe. My father was 99. He would have been 100 on August 24th. He was cared by two people who visited him every day, who took very careful precautions about COVID. He passed away April 13th. The week before, one of the caregivers called me at night. They said, "Jeff, come on over here. Your dad seems very short of breath." So I hopped over to his house with my stethoscope. I examined him. And at that time, I realized he most likely had COVID. When he became sick prior to passing away, I took care of him in the house. I didn't want to hospitalize him because of his age. And we ordered oxygen for him. I took care of him, and a week later, I went for a COVID test, and I was positive. I was asymptomatic. I had maybe some mild stuffiness in my nose, but other than that, I felt quite well. I went over to the emergency room, and they told me, after they took an x-ray, they said, "Your x-ray is normal, your blood tests are normal, but Jeff, you're positive for COVID. Go home now, stay in the house, self-quarantine for the next 14 days. Take your temperature every day, measure your oxygen level with a pulse oximeter, which I put on my finger, and let us know how you're doing." For the first 5 days, I felt great. But the Monday evening, 5 days after I visited the emergency room, I started getting chills and fever in the evening. And my cough increased significantly. I was really never short of breath, but every time I tried to take a deep breath, I couldn't because I coughed. I thought I wasn't that sick, but actually I went to the emergency room 10 days after my first COVID test on a Sunday, and this time they did a CAT scan and they told me, "Jeff, you have pneumonia in both the right and left lungs. Your blood tests are abnormal, and we have to admit you to the hospital." I had lost 10 pounds by that time, and I was in the hospital for 5 days. Luckily, I'm here to tell my story, and I'm now back to normal health and doing quite well. But COVID is a serious illness. Many of us take it for granted. This is an illness where if you're elderly or over age 60, you have a higher incidence of dying. But we've seen multiple young people and people in their 40s and 50s also die of COVID. We know that if you have comorbid conditions, meaning if you're obese, or you have diabetes, or you have heart disease, or you have chronic lung disease, or you have cancer, or you have an immune deficiency disease, you have a much higher rate of dying from COVID. We have to realize that there's 3 things we can actually do. We must wear a mask to protect others and to protect ourselves. We need to do social distancing. We know if we're exposed to someone or come in contact with someone, we need to self-quarantine ourselves for 14 days and tell everyone else, our friends and our relatives or whoever we've come in contact with, that we've been exposed to COVID. It is a serious illness, and we need to be very careful about taking care of ourselves.